At the outset, let me extend a thanks to CMG Global, to Sanjay and Anita for inviting me here for the International Medical Tourism. And I bring you warm greetings from, not working, yeah, sorry, thank you. I bring you warm greetings from the city of Mangalore, which lies on the western coast of India. I work in this hospital and I specialize in navigation, arthroplasty, sports medicine, and arthroscopy. I'd like to begin my talk with this slide. The date, 22nd May 2010, a day which Mangalore is not going to forget soon. Because on this day, we had one of the top 10 airline disasters recorded in history. An IHTC 812 flight from Dubai to Mangalore overshot the runway and it landed on the valley below, killing all 166 guys abroad. Now, what happened on a clear day at 6 a.m. in the morning on the clear skies? There's no reason the pilot could have overshot a runway, except unless it was an error of human judgment, as was concluded by the later reports. If you see the slide here, you'll find that if I were to ask you which of the two dots on the center are equal, I'm sure all of you would say that the dot on the left is the one which is bigger and the one on the right is bigger. So on the other two slides. But the human eye can seldom perceive variables of distance and size. If you see, all the dots are the same, the sizes of the ball are the same, and there's absolutely congruity in the lines. This is where navigation comes into play. Here we have a global positioning system now, which is well in use, as you all know, which will give you an accurate landing gear for the aeroplanes to land. It reduces human error and is consistent and reproducible. This is where navigation is critical in every high-risk industry, be it the airlines, be it the steel industry, be it in the seafarers industry. We are a cricket-crazy nation, and we hold our breaths with the bated breaths every time Virat Kohli is given out and the decision goes up to the third umpire. And that's where navigation comes into play. It navigates, it gives you an idea where the ball is navigating, whether it's hitting the stumps or not. We are worried about our alignment, isn't it? We take our cars for alignment. And every time, the alignment also depends on something quite similar to a GPS. And when technology is used to help computers and navigation in all aspects of mechanical life, why should modern medicine be far behind? To achieve better results, reproduce it every time, with every patient, and with the bare minimum complications. A conventional total knee arthroplasty, if it is malaligned for more than about 10 to 15 degrees, you have a good chances of failure rates, as is documented that with papers, they say that almost about 60% of the patients had significant abnormal changes. So also in a conventional knee, if you do, and during the revisions, in malalignment, you'll have breakage of polys or breakage of the implants being tilted, the implants breaking out or backing out, and then you need to have a revision need to be done. Severe deformities and expectations from patients are a norm everywhere. We see these patients time again, whether it's India, whether it's Africa, whether it's Europe, these are there. So, can I have, yeah. So also with obese patients and patients with having trauma, whether they have implants inside the knees or the hips and inside the femur. In these are the cases where a conventional total knee would not really work, and this is where navigation comes into play. So why is navigation important for all? If you see an X-ray taken from the patient from the long leg view, you find that it is technically impossible to chart a good mechanical alignment in these patients. And you need to give a very good preoperative and a post-operative X-rays for the patients to align them really nice. So in navigation, It assists you in a very good pre-surgical planning for the surgeon, as well as in guiding and performing technical surgeries. It basically consists of a navigation machine which is mounted with a camera on the computer, a pointer which is handled by the surgeon to mark the anatomical landmarks, and the trackers which are placed on the bones. Now, these are the older types of navigation machines where the pins are placed on the femur, on the above side and the lower side on the legs. And here, now, we have something which is much more advanced. We have the articular surface mounted navigation machines. There's no pins. The incisions is really small. The amount of trackers which are mounted can be done even in obese patients. Here you see the trackers mounted on the tibial surface. And these trackers are picked up by the camera and the navigation machine, and they tell us precisely how much of bone needs to be cut. The advantage of this system is that you cut a bare minimal of bone, give a good soft tissue balancing to achieve good results, whether it's before surgery. If you see this patient on the right side, she's a youngster, relative youngster at 55, could barely walk before surgery, and at 6 months after surgery, she's got a fantastic result, and the demands of the patients are very high. You don't expect a patient who's 50, 55 to be sitting at home with pain. You expect them to go out. They want to go to the market. They want to go to the functions, whether it's wedding or whatever. They need to do all the work. And this is what you can achieve with a good navigation, preoperative and postoperatively. Excuse me? Can I have the videos, please? Deformities like this. This gentleman has tried all sort of treatment, including tying his leg into the splint for about 3 months and lying down in bed thinking that it would straighten out. Unfortunately, it doesn't. But a good surgery with navigation in such gross deformities can give rise to an excellent result, whether the patient is walking, doing his day-to-day activities, whether he's squatting, and whatever. You can see this patient that in spite of this deformity prior to surgery, he's got a reasonably very good range of movement, and he's able to get all his knee flexion extension done. This is another patient who actually came at 55 years, and he never got married. So he had pain and deformity. So he said, "Doc, my time is up. 55, I'd still like to get married, and I want a straight knee." And this is what you can do, cosmetically as well as by giving him a good result for pain. So before and after surgery. This was a patient which I did just about a couple of days before I came. So it's just about 2 weeks. And you can see there's a very good correction of his deformities. So even in extra-articular deformities, whether there's a congenital deformity of the femur or the thigh bone, and where it is grossly deformed, we can achieve a very good mechanical alignment of the leg. The recent joint registry from Australia shows that there's been an increased use in navigation, especially amongst the younger surgeons, and it is technically proved that navigation is required to establish a good surgical outcome. Navigation reduces the overall rate of complications in patients, as well as in obesity, in grossly obese people also, a navigation is a wonderful tool to use. Computer navigation is not something one needs to be worried about. It's all about pleasure. It's all about being very accurate. It's all about being very simple instrumentation. It's fast, it's genuine adjunct to a surgeon, it's a technology that assists a surgeon without overwhelming the surgeon. Thank you all for your patient hearing, and thank you, Anita and Sanjay, for inviting me here. Thank you.